My name is Kellyn Pollard. I am an Oklahoma resident for a majority of my life. I left Oklahoma in 2015, and while I was there, I got my bachelor's degree in biology from Langston University. And then after I left, I moved to Texas, and now I am a clinical research coordinator slash regulatory coordinator for rare genetic diseases at the University of Texas Southwestern Medical Center. I have a few chronic illnesses. The main one that I deal with is called endometriosis. It's a painful disorder that affects the lining of my uterus. So I can have discomfort ranging from during my cycle to all day. I also experience extreme brain fog and chronic fatigue. So I also have chronic fatigue syndrome, and that's coupled with chronic pain syndrome. I also have adenomyosis. I also have fibroids, which flare every once in a while, cysts, which occur every once in a while, as well as my newest diagnosis, which is fibromyalgia. The only one of those illnesses that I was diagnosed with in Oklahoma was endometriosis. So I got that diagnosis in 2014, and then I shortly left Oklahoma afterwards. The standard or golden treatment, I guess you could say, for diagnosing endometriosis is what's called a laparoscopy. After having that surgery, I wasn't explained to what endometriosis was. Even to have the laparoscopy, it was briefly explained that that's what they were looking for, but it was emphasized that they probably wouldn't find anything, that this was just normal growing pains of being a woman. I was 20 at the time of the surgery. So I had been in puberty for 10 years by then. So, and it had always been very painful. And I was given the standard treatment of here's some birth control and here's some pain medication. And if these don't work, we'll just keep, switching those up. So very, very minimal care, very little explanation of what exactly I was diagnosed with, and also what that meant for my quality of life. One instance in particular stands out to me in terms of some of the discrimination or lack of experience from doctors, even just primary care doctors. So I didn't have a gynecologist when I was in Oklahoma until right before my diagnosis, just because I think my primary care doctor was tired of dealing with my chronic pelvic pain. And granted, I should have asked for a gynecologist, but before it got to that point. But I went to my primary care doctor for chronic pelvic pain and chronic bleeding that I had been having for quite some time. I was just given pain pills and was told, if my pain gets worse, call the office and they'll do something else about it. Which I was okay with, because as most chronically ill people can resonate with, I would much rather pay for a office visit than a ER bill. So the medication wasn't still helping with the pain. I called the office and was then told to sit in an Epsom salt bath for an hour and see if that helped. This was not muscle pain. I was not experiencing muscle fatigue or anything like that. And looking back at it, I can laugh, but back then it was kind of devastating. A lot of time, especially if you're going to see a PCP, they have 15-minute windows to talk to you. So if you come in there prepared with what your symptoms are, what those possible conditions are, especially if these are conditions that run in your family, that can be pretty helpful, because then you can kind of, it's weird to say, guide your doctor in getting the kind of tests or assessments or procedures that you may need for diagnosis, because you're living your life every day with this. And a lot of the doctors that you will see will not, they know you from a textbook. They don't know, what it's like every day. So just bringing those things to those attention and, being loud. There's no change if no one is standing at the front or in the crowd even saying something. Because you never know, it could just take one person to hear you out for a change to begin. Use Instagram and use Facebook. They are very good tools. I know a lot of the times, at least for rare diseases, there are support groups that are online, but there's not a lot that are prominent with other more typical illnesses. But there are plenty of groups or Instagram pages that you can join, and once again can show you different sides of what your condition can look like or may look like, especially if it's a progressive disease. Um, and then being able to use that information and tuck it into your arsenal or your back pocket if anything in your health begins to change.